Good afternoon, everybody. My name is Dr. Kiran Marthak, and today we would be essentially doing the revision of the modules that you have studied. And so that we will be starting today, and I'll be showing you the slides. And this is being a revision, we'll be going a little faster. And in case if you have any questions, you can type or you can talk, and I will try to respond to you. So let's begin with the presentation today. So this is the, as you can see, is the revision of the first trimester, the first semester of the course in the clinical research activities. And to begin with,
you say so.
To begin with, we will what we will do is to give you some idea about what has been covered and what are the contents, and then we will go into the details of the every aspect. And then, in case if you have any questions, feel free to ask. We will roughly take about uh, 2 hours or so, uh, which I'm sure would be enough for the revision purpose. And of course, if you have any questions, do feel free to ask me. So we are just adjusting this slide presentation. Just hold on, please, for a second.
And why it has not come in? It should have come here because we have already kept it open now.
We are just finding some technical problem. Just hold on, please. There is some issue in broadcasting, which we are trying to sort it out. I apologize for this delay, but it's beyond our control. As you know, sometimes the technical things they just behave in a very erratic manner, and my colleague here is doing his best, and he's expert in it, and he's trying to resolve the issue. And I must thank each one of you for participating on a Sunday afternoon, and particularly post-lunch. Probably many of you must have just finished your lunch, and hopefully it will not lead you to any, will not precipitate your siesta. So I'm sure we'll keep it very short and sweet, easy to understand, so you don't have to text too much, and which will prevent from any tiredness or boring feeling. So we'll try to make it as interesting as possible.
You start teaching them why this.
Okay. So what I will do is in the meantime, we will start the the first slide is on revision of the first module.
Open it in this. You just open it in your this and you read it and you told them because it is not getting shared. See me? Have you opened it?
Not yet. Yes. This is the Gmail.
So open that dirty mail which is given, which is
Not this. This is okay. This is happening.
speak. You can look into this and you can see. It will open. Once open, you can start teaching them.
Can I send the email here?
No. I don't know why it is not opening. It's open. Now you can show sir.
Okay.
Yes. Start.
Yeah, I think we have sorted out the problem, and I hope you are able to see it. And So we are doing the revision of the next.
You have to click it here for the next.
Oh, okay. So what is your extension number if I have any problem?
No, I'll be there, not here.
Okay.
Take the mic towards your start.
Yeah. So we are now starting. We have resolved the issue, and
Speak.
this today's talk we will essentially cover the module 1, the health and diseases, module 2, disease and treatment, and module 3, the introduction in drugs and disease.
Keep it down, and you have to look up something.
The module, the topics that will be covered will be mainly the introduction to clinical research and its glossary, introduction to pharmaceutical industry, and it will essentially, which was covered was the history, the international and Indian scenario, the health and diseases, which also mainly the definition of the disease, disorders, morbidity, mortality, the illness stages of the disease, etc. The blood and its constituents, and essentially this covers the liquid part, which is plasma, the serum, the cells, which are WBCs, RBCs, platelets, and in WBCs, essentially the granulocytes and agranulocytes. The cell and its structure, its anatomy, the composition, and the functions. And as we know, the structures of the cell is essentially the nucleus, nucleoproteins, mitochondria, cytoplasm, protoplasm, and the cell wall. And in the microbiology, it's essentially mainly related to some of the general methods used in the study of microorganisms, and later on something on immunology, which is the very latest in treatment of the certain diseases, which includes the uh, treatment for cancer, which is the latest therapy so far as immunology is concerned. The next we will cover the We will essentially then later on cover the main highlights like what is the clinical trials. And as you all know, the clinical trials are essentially related to proving the efficacy and the safety of the drug. The different phases of clinical trials like phase 1, phase 2, phase 3 and phase 4 clinical trials. There is also something like what is called as phase 0 trial, which is not allowed in our country, but abroad there is something like phase 0 trial, or also known as microdosing of the clinical trial. Then something on Indian GCP. As you know, the GCP stands for Good Clinical Practice, and good clinical practice is very essential for the any conduct of clinical trials. And this GCP is made into action sometimes in early 90s, and mainly so that the if the trials are conducted as per the ICH-GCP guidelines, the the data which is generated by this particular method is acceptable by every regulatory authority, including the US FDA, Europe, and also the UK, and even Japan. The opportunities in clinical research, tremendous opportunities, essentially not only for the conduct of clinical trials, but also for the regulatory side, even for patents, the preclinical side, including the toxicology, etc. So that also is a part of the clinical trials. And in India, the India is a hub for clinical trials because, as we know, the population is very large, and the certain diseases, including the infectious disease, also the disease called for hypertension, diabetes, hypercholesterolemia, all the diseases, and also cancer, particularly the treatment naive patients, are very rampant in our country. Besides, the investigators are also uh, we are very well trained. Most of the oncologists are trained abroad, and they exactly know how to conduct the clinical trials. And therefore, the clinical research has the tremendous opportunity so far as India is concerned. There is also the other highlights that we need to consider is the for the introduction to pharma industry, and which is mainly related to the pharmaceutical products. As we know, there are certain new chemical entities, there are generic products, and these generic products are essentially the generic products are essentially mainly related to the products which are already in the market. And this product, which are generic products, they are mainly uh, preferred nowadays because of its economy. The insurance companies also prefer the generic products. The the other thing that we need to know is the evolvement of the pharma industry. And in this evolvement of pharma industry, that is, I normally call it as a metamorphosis of the pharmaceutical industry, which started sometimes in 1970. Earlier days, they were only importing of the pharma products from abroad and selling it, which are becoming more expensive. So India then, the pharma companies started making API first, and then they started making the formulation. Then they started exporting API, and then they started exporting the formulations also. Till the extent now, the India, the export is pretty high, mainly to USA. You'll be surprised that the number of India is the second largest country exporting the drugs to USA after China. And even the number of manufacturing units in India which are producing the API and formulation for export to USA particularly, India is the second largest country. So that shows how the industry has evolved. and quite a few Indian companies have also started on the research activities, and therefore their R&D centers are pretty active, and they start right from the development of the library of the molecules to the they normally go up to phase 2, phase 3, and then they outlicense the molecule because they do not have enough funds to carry on the right up to the filing of an NDA. But still, what they do is they try to out license the product with certain rights to market the product in India and China, and then they also get the royalty of the uh, uh, marketing the products abroad. So this is the kind of situation it is, and this doesn't this pharma industry also includes the products which are meant for dentistry as such. The so far as the concept is concerned, is essentially the biomedical concept, which is the ultimate game is to see that there are minimal diseases which are faced by the human beings, and therefore one needs to understand the equilibrium between the disease and the health, and more uh, at present there is a more and more demand for the treatment of the disease by the quality of life. The quality of life is very important in the treatment of the disease, and this way uh, one can definitely come across the better way of treating the patients. So that is very important, and the going to the other aspects of the health and diseases, in which the important highlight is the how the disease occurs and what are the kinds of diseases. And this is essentially because there are acute disease, chronic disease, and there are also the diseases which are in which there are human beings are carrier. To give an example is something like thalassemia minor, and in this the ladies, the females are the carrier while the males are sufferer. So this is how the disease profile takes place. Acute diseases are more of the respiratory infections, urinary infections, pneumonias, meningitis. These are all the acute conditions, and the chronic conditions are mainly related to the skin diseases, chronic bronchitis, and the chronic diseases like amoebiasis, the worm infestations. So all these are the examples of the chronic diseases. The uh, the clinical trials and its applications essentially to various stages of the disease, and in this the mainly the natural history of the disease is very important. And in this, if we have to look at it, there are various ways of doing the clinical trials and various reasons for doing the clinical trials. And in that, essentially, there are certain trials which are for the prevention of the disease, and which are mainly this for prevention is essentially the vaccine business, where the vaccines are produced to prevent the disease, which includes like tuberculosis, typhoid, cholera, polio, hepatitis A, hepatitis B, hepatitis C. So these all are the examples of the prevention of the trial. There are certain trials which are done for the called as the screening trials, and these are the best way to detect certain diseases or the health conditions, by which they do the epidemiological study and try to find out which is the best, which is the maximum disease that occurs. Then others are diagnostic trials. Treatment trials are most commonly carried out for treatment of the disease, right from the various therapeutic areas, right from oncology, hypertension, diabetes, metabolic disorders, the respiratory infections, psychological, psychosomatic disorders, etc. And as I was mentioning about the quality of life trial, this is the latest one, and is the most important aspect is the quality of life is very important so far as any subjective evaluation of the clinical trials. The the various therapeutic areas for which the clinical trials are conducted. And these therapeutic areas you must have already learned is essentially the cardiology and vascular diseases. There are dental and oral health care, and this particularly for you is very important because the dental health plays a very important role, and the oral cavity can give you a lot of guidance or the indication for the systemic disease in an individual. Like if you see the receding gums, you will find that the receding gums, if there are, and there is also periodontitis, one of the first thing that one can think of is the diabetes mellitus. The other diseases like with the halitosis, or there are ulcers in the mouth, one can try to find out that there are certain diseases which are common in the oral health care. The immunological conditions, the nephrology mainly related to the kidney and urinary tract. This includes not only acute and chronic nephritis or glomerulonephritis, but also renal stones, CA of the kidney, CA of the bladder, CA of the prostate, which are very common, and also something on urinary incontinence, which is again one of the very major factor in the elderly age groups. Hematology and oncology conditions, as I already mentioned, and hematology particularly related something like anemia, leukemias, and the blood clot disorders, very important again, and particularly nowadays, uh, aspirin plays a very major role in the formation of blood clots, and it can prevent the blood clot, and therefore it is again important if you are carrying out any oral surgery in a patient, the you have to ask this patient to stop taking aspirin at least 3 to 4 days prior to any surgical work. Otherwise, the patient will keep on bleeding for a longer period of time. Infectious disease is very important again because the infectious disease in India is very common, whether it is viral, whether it is bacterial, parasitic infestation, fungal infections plays a very major role in a particularly in the tropical climate in the country. The family medicine, again, more related to primary care physicians, where like common cold, diarrhea, the backache, all these are the family physicians kind of the disorders which are of the shorter duration, but it constitutes a very large patient population. The pediatric age group and neonatal population, recently there is a tremendous demand for pediatric trials, not only for the disease part, but also if there is a pediatric trials conducted, the patent life of the product increases by varying from 6 months to 2 years, and therefore there are companies who are interested in doing more and more pediatric trials. Neonate population plays a very major role because there are certain conditions which are prevalent in the earlier days of the life. And here in pediatric and neonate population, particularly the congenital deformities, which includes something like ASD, VSD, phallostatology, mitral incompetence, mitral valve diseases, all these play a very major role in the pediatric and neonatal population. There are trials with devices, and there is also studies, particularly bioequivalent studies, are carried out in the healthy subjects. So you can see the wide variety of the clinical trials which are being conducted in the human beings. The if we go to the composition of the blood, as we know, the every human being has a 5 liter of blood, and of which constitutes the 55% is plasma and 45% is the cellular components. And cellular component essentially forms the RBCs and the WBCs and platelets. And if you see this slide here, there is the composition of the blood where it is essentially showing you in the plasma, if it is which is a liquid part, 55% composition, and essentially it contains 90% is water, and then other constituents are amino acids, the nutrients, the electrolytes, the proteins. There are certain gases in it, and the proteins are essentially the albumin, globulin, and fibrogen. While in the formed elements, there are essentially the WBCs, RBCs, and platelets. And in the WBCs, particularly granulocytes and agranulocytes are which are without the granules in the plasma of the WBC, they are lymphocytes and monocytes, while the granulocytes are of three types, that is neutrophil, basophil, and eosinophils. So this slide again, it just gives a summary of the composition of the blood, what I mentioned just now. One more thing that we need to add in this is the platelets, and the platelets plays a very major role, particularly in the thrombosis of the blood. And clotting mechanism essentially depends on the release of thrombokinase enzyme from the platelets, and this now plays a very major role, and particularly in the diseases which are very prevalent nowadays, and this platelet plays a very major role in that. So platelets now is one of the very important cellular composition of the blood as such. The blood diseases are, as I mentioned earlier, anemia, and this anemia is essentially which is aplastic anemia and sickle cell anemia. Sickle cell anemia is also called as the in sickle cell anemia is essentially the RBCs, they become sickle shape and they form clotting. And this is a very important part so far as thalassemia major or thalassemia minor is concerned. That is related to red blood cells, and the white blood cells is myelofibrosis, myeloma, myelodysplasia, and lymphomas. And the platelet disorders are mainly related to thrombocytosis, clotting mechanism, as I mentioned earlier, hemophilia, and in hemochromatosis. So these are the major diseases which are important so far as the dentistry is concerned and so far as the clinical research related to dentistry is concerned. The The other things which are important to learn is about the microorganisms which cause the diseases, and these microorganisms, they are of the different kinds, but any infection will lead to the certain features, and any microorganism when it invades any of the tissues in the body, it externally it shows up like fever, tiredness, body ache, weakness, certain times skin reactions, particularly in the viral infections, and particularly something like mumps or uh, rubella kind of disease, in which, as I mentioned, measles or chicken pox, all this shows as a skin reaction, and then one can diagnose the conditions. And then there is another one which are very common is gastrointestinal infection leading to frequency of loose stools called diarrhea. This slide shows mainly related to the immunology part. And in immunology, the major factor is the T cells, the NK cells, and also the disease, the something like what is also called as CD4, which plays a very major role in it. The neutrophils, basophils, eosinophils, also which are manufactured inside the bone marrow, plays a very important role. The overview of the immune response. Immunology is a very latest aspect in causing the treatment, and also one has to understand very clearly the uh, how the immune response takes place. The if one looks at it, it's like an antibody mediated immune response and also cell mediated immune response. What is most important here is one has to understand that what you see as the disease is essentially the antigen antibody reaction. And in that, what happens is there are B cells which are active, there are T cells which are active. based on where the antigen antibody reaction which is taking place. So this is something which one has to understand very, very clearly. And as I mentioned earlier, the T cells and the B cells with the antigen antibody reaction plays a very major role. The treatment, the examples of the autoimmune disease, they are mainly multiple sclerosis, juvenile diabetes. Now, juvenile diabetes is also known as a type 1 diabetes, and in this type 1 diabetes, there is a total lack of manufacturing of the insulin, and therefore, these subjects who have this disease, they do not have beta cells in their pancreas or in their islets of Langerhans, and this leads to a total failure of the glucose metabolism. And right from childhood, this child suffers from diabetes, and this in this condition, therefore, what is required is to administer insulin every day to the patient. Without insulin, they cannot function at all. As opposed to type 2 diabetes, where there is a lack of the manufacturing of insulin, and the beta cells need stimulation by certain drugs, which produces then the insulin, and that insulin of the body acts on the glucose metabolism and tries to control the sugar level in the blood. The systemic infection, the disease like systemic lupus erythematosus and rheumatoid arthritis. Out of these two, the rheumatoid arthritis is very common, and this rheumatoid arthritis is more common in female subject than male subject, more common in the younger individuals, and also it affects the smaller joints of the body. And here the cartilages of the joints are affected because of the antigen antibody reactions in the joint space, and it ultimately erodes the cartilage and causes very high inflammation at the joint spaces. And here the most important part is to give the drugs which will suppress the autoimmune mechanism, so that there is a reduction in the antigen antibody reaction, which ultimately reduces the inflammation, pain, swelling, and brings about the better movement. So these are the particular conditions which are very important so far as the autoimmune disease is concerned. So what we have done is essentially, if we see the treatment of topics which have been covered, which are mainly for the dental disease, pain, inflammation and its treatment, heart disease and dentistry that we will see very soon, HIV we will see very soon, and also diabetes, how it affects the dentistry line, the oral cancer and the antibiotics. The dental disease which are related to infectious disease relevant to dentistry, and these are periodontitis, peri-implantitis, dental caries, pulpitis and periapical periodontitis, opportunistic mucosal infections, and viral. Here, very important is periodontitis and peri-implantitis and dental caries. And out of this, the most common one is the dental caries, which is you will see in your day-to-day practice, the caries of the dental, and then there is a pulp of the tooth which is involved. In periodontitis, it is essentially the gingiva which is involved, which can lead to receding of the gums and cause more infection into the pulp, and the tooth may fall off ultimately. There are implants which are put, and if the implants are not placed properly or there is no precaution taken, then it can also lead to the infection in the implant. And sometime in certain condition, if the infection does not subside, one may have to even remove the implant which is put uh, in a particular tooth. The pulpitis we have already covered, then opportunistic mucosal infections and viral infection. This opportunistic mucosal infections can also cause the tartar deposition in the on the inner side of the uh, uh, tooth. Pain and inflammation and its treatment, the main question that one should ask to the patient is the pattern is, or where, how did it start, the onset, the since how long, and each time how long does the pain remains, the location of the pain, where exactly it pains, whether it is, which will help you in finding out whether it is a referred pain, which is many times the referred pain is in the upper maxilla when due to maxillary sinusitis. Then the intensity of the pain, the mild, moderate, or severe degree, whether it is a mild pain or a severe pain, where the pain comes in the way of doing day-to-day activity, it leads to severe pain, and then even referred it to, and it can also cause a severe headache in the individual. And the nature of the pain, which is essentially the description of the pain, whether it is a throbbing pain, dull pain, shooting pain, which then gives an idea about whether it is because of the infection, whether it is a referred pain, or whether it is whether it is due to some injury, external or internal. The pain, in your dentistry practice, you will find many patients receiving painkillers, which you may have to even give to the patients, because most of the dental conditions leads to pain, whether it is periodontitis or pulpitis, or a cavity of in the teeth. And some of the painkillers are safe, but some painkillers, including paracetamol, can cause the serious and the severe side effects. And some of them are, as I've listed here, is itching, delirium, sedation, sweating, confusion, depression, anxiousness, upset stomach, pupil constriction, and flu-like syndrome, fatigue, tremors, sometimes euphoric condition, sometimes even hallucinations, particularly with the products like tramadol. The sleeplessness again is again mainly the paracetamol, and the drugs like ibuprofen can cause the sleeplessness, muscle spasm, extreme irritability, and muscle and bone pain. The dentistry and heart disease, here one has to look mainly for periodontal disease, and in that the and also the tartar deposition. The more the tartar, there are more chances of subject having atherosclerosis, and atherosclerosis ultimately leads to the heart diseases. And here again one has to keep in mind the diabetes, preterm birth, the heart disease, and pulmonary disease. The uh, the other conditions which one has to keep in mind is mainly related to periodontitis and the heart disease, systemic bacterial infections, also the promotion of atherosclerosis, as I mentioned earlier. In some of the conditions, like where there is a disease profile, like as we see the thrombocytosis, thrombocytopenia, all this it can also indicate that there is something wrong with even liver, which ultimately indicates that there is some problem going on with the formation of platelets in the body, and which ultimately causes the bleeding disorders in the patients. The the problem that could arise out of the poor dental health, and as I mentioned earlier, the atherosclerosis, the heart disease, the mouth oral cancer. This is very important. You will see many subjects uh, in your private practice with oral cancer, and this oral cancer is essentially because of the certain irritants. There may be a tobacco chewers, the smokers. There are people who keep the betel nuts in the mouth, the gutkhas, all this, which ultimately leads to the mouth cancer. Diabetes I already mentioned, gum disease I already mentioned. There can be just a fall of tooth without the knowledge of the patient, and this condition leads to which indicates the first thing that you should come in your mind is the diabetes. The patient of diabetes can just loose tooth without his knowledge, because the diabetes causes perineuritis, polyneuritis, and the subject do not come to know that there is some kind of an infection in the root of the tooth, and that keeps on multiplying, and ultimately the subject loses the tooth. There can be a dental decay, the lung conditions, and also it can rarely lead to the stroke in the brain. HIV and dentistry, they assess the main important aspect is to assess the risk factor for HIV infection, and in that one has to see whether there is any specific lesion in the oral cavity. And here the basic treatment for oral lesions is actually the acyclovir gel, and also the various uh, drugs available for HIV and AIDS. But the important part here is, as soon as you see a patient or suspect a patient having HIV, get the HIV test done, and if it is positive, immediately refer the patient to HIV sub HIV consultant or to the NGOs. But more important here is to uh, convince the patient to go and show to the HIV consultant, because many times the patients do not realize that they do have HIV, and they need treatment. And if it is neglected, it can lead to a serious issues, including death of the patient. Uh, there are certain factors which one should keep in mind to doubt about the patient suffering from HIV or AIDS, and this is mainly related to the uh, sexually transmitted disease. There are limited access to or social non-acceptance of the condoms, which with the outside or with the multiple partners. The war and civil disturbance is a major factor which leads to a subject developing the HIV because of the sexual contacts. There are certain areas where they take pride in visiting the sex workers, and they do develop the HIV or any other sexually transmitted disease. Women of low status, low literacy rates, where they are not aware that with the multiple partners without using a condom can lead to HIV or AIDS. Increasing urbanization, migration, mobilization, low level of political commitments, exposure to blood from unsafe medical practices. There are certain times where there is the blood transfusion takes place, and in that, the if the blood is not checked for the HIV virus in it, it can cause the to a subject who received the blood the HIV or AIDS infection. The risk factors are the unsafe sex, the man having sex with man, that is the shooter, the having the homosexual characters, and this here is sodomies, and that is man to man having their actual sex. Then injection drug users, there are drug users who take morphine, cocaine, heroin, they all take drugs and they take it intravenously, and the needles which are being used, they are not sterilized, they just use the repeated same needle, same syringe for multiple times, and that also leads to the HIV. The migration and mobility, low status of women we already covered, and widespread stigma. uh, The oral lesions, which is also known as the harbinger of the HIV status, and this is often the first clinical feature. As soon as you see oral lesions, immediately refer the patient to the HIV consultant. And new lesions which are in HIV infected patient is essentially the sign which says that if there is a new lesion which is developed, the disease is progressing, and if the candidate do not take the proper care, it can lead to increase in the severity, and ultimately it can cause a severe infection not only in him but also with the other sexual partners uh, that he may be in touch with. So it can spread very rapidly so far as HIV is concerned. The signs of acute HIV infection is, if you can divide into central and systemic. The central is essentially the malaise, headache, neuropathy. There can be enlargement of the lymph nodes. There can be skin rashes. There can be nausea, vomiting. There can be enlargement of the liver and spleen, leading to cirrhosis of liver, leading to portal hypertension, leading to increase in the size of the spleen. It can also cause ascites uh, with the portal hypertension. It can be a pain in the muscles, causing myalgia. There can be the pharyngitis, the mouth ulcers, or the patient may just come with the soreness of throat, and the systemic can be the fever and a severe weight loss in the patients. How the HIV gets transmitted? It mainly gets transmitted through the sexual contact. If the mother is having HIV and she is pregnant, she can pass it on through an umbilical cord to a newborn baby. So it can be transmitted to the fetus from the female, and also through the breast milk, because the virus is excreted through the breast milk uh, to the newborn baby. So it can be transmitted through the blood or through the breastfeeding to a newborn. The injection takers, we already mentioned about it, particularly the drug users who take the injections intravenously, and the needles are not cleaned, not sterilized, and therefore ultimately leads to HIV infections. And certain occupational diseases, like even the medicos or the nurses, if they come across any infected blood, and if they have a cut in their body or in the hands, the blood, if it comes in contact with the ulcers or the cut, the viruses can pass through the open wound and they can develop the HIV infection. And the blood transfusion, if the blood is not checked properly prior to giving infusion, patient can suffer from HIV transmitted through the blood transfusion. The diagnosis of HIV can be easily done by the immunoassay, enzyme immunoassay technique, and also the Western blot technique. The most commonly used is Western blot technique because it is easily done, very fast results you can see. But the immunoassay is the latest method by which one can find out. The other things are mainly the what is necessary to be carried out is the counseling at the time of pregnancy, perinatal transmission, if it is the at the time of pregnancy, if the patient takes the proper treatment, there can be reduction in the transmission of the disease. And the very important aspect is to give the counseling to the subjects, and also ultimately refer the patient to the consultant or HIV so that they can take a proper and a correct line of treatment. Let us now shift to the how the diabetes and dentistry, uh, the relationship between the two. Yeah, as you know, the diabetes is mainly because of the insulin secretion, which is less in the body. And this insulin is produced by the beta cells of the pancreas, and beta cells of the islets of Langerhans, and islets of Langerhans are present in the pancreas. So pancreas plays a very major role so far as diabetes is concerned. And as we know, the diabetes is of two types, type 1 diabetes and type 2 diabetes. In type 1 diabetes, there is absence of beta cells right from birth, and the subject develops type 1 diabetes in a very early stage of life. That is, at the age of 5 or 7 years, there can be a detection of the type 1 diabetes. While type 2 diabetes can occur at any age where there is a deficiency of production of insulin from beta cells. The difference between the two is the beta cells are present in type 2 diabetes, but they are secreting less insulin compared to what it should produce in the regular human beings. So this I have already mentioned about it. So you will see the type 1 is called insulin dependent diabetes and type 2 is non-insulin dependent diabetes. The symptoms of diabetes is that the subject feels very tired, the frequency of passing urine is more, there is a sudden weight loss in this because this his body mechanism does not allow him to use his carbohydrate at the muscular level, and there the there is the metabolism of the glucose which suffers at the peripheral level, which leads to dystrophy of the muscles, and that makes the person to lose weight uh, with the diabetes. The another sign to suspect diabetes is the wounds in the body takes a longer time to heal. If there is any operation carried out, the scars remain persistent for a longer period of time. The scars may get infected and may not get healed that fast. There can be sexual problems, particularly erectile dysfunction, which is very common in type 2 diabetes. The patient also feels very hungry of type 2 diabetes, and the diabetes also causes blurring of vision because of the effect on the retina. It affects the rods and cones, and also it reduces the supply of sugar in the retinal through the retinal arteries. There can be polyneuropathy leading to numbness of the peripheral limbs, and this is mainly felt in the sole and on the toes. Patient comes back saying that he feels tingling and numbness on the feet, and that particularly if it is in the elderly age group, one should suspect there is a diabetes and get it checked. And the patient, as I mentioned earlier, the patient feels very hungry and also very thirsty. And in females, they are more prone to vaginal infection, just like vaginitis, and they have a leukorrhea. So again, in a particular age group, around the age of 35 plus, must suspect diabetes and get the patient investigated for diabetes. So these are all the main conditions, main symptoms for which the patient comes for the treatment, and that time you must suspect the diabetes and get the subject investigated for blood sugar and HA1 HbA1c is the major important diagnostic factor for diabetes, and HbA1c stands for glycosylated hemoglobin, and that also is very important for any clinical trials, HbA1c, because that is the one which exactly gives an idea about in last 3 months time what was the average blood sugar in a patient. So all the clinical trials, they will like to evaluate HbA1c initially and at the end of 3 months of treatment. To summarize on diabetes mellitus, it is treatable but not curable. It is preventable in obesity in adult patients. There are enough diagnostic tests available to uh, identify and to diagnose the diabetes at an early age, so it can further we can further prevent the deterioration of diabetes and also its sequelae, as I mentioned earlier. The signs and symptoms of hypoglycemia and hyperglycemia here, the many patients, if they are not taking the treatment properly or if they are not following the diet properly, they can lead to hyperglycemia or hypoglycemia, and one has to treat the subjects accordingly. If the patient has hyperglycemia, one needs to inject insulin, and if the patient has got hypoglycemia, one has to inject glucose inside the body, which is available in the form of 25% or even 50% glucose to bring up the glucose level in the body. And nursing implications are many, essentially to monitor the blood sugar if possible, practically every day, fasting and postprandial in the diabetic patient, so that one can understand, particularly those patients who are on insulin, the dose of insulin that needs to be taken by a patient. The If we look at the periodontal infection, which is mainly related to the bacterial infection, and the bacterial products are mainly related to fimbrotic ones and the inflammatory mediators like interleukin 1, INFV, interleukin 6, and interleukin 8. These all then ultimately cause the inflammation, and it leads to periodontal infection in the body. And all these interleukins and all these are all the biomarkers which gives an idea about what kind of interleukins is responsible for the inflammatory reaction at the time of infection. And one of the other factor which is important is the TNF alpha, that is tumor necrotic factor. That also plays a very major role, particularly when it is related to the acute phase of the inflammation. And in that, not only TNF alpha, but C-reactive protein, which is also put it down as the CRP, uh, uh, which gives an idea about the inflammation, and one can track, or one can even try to find out whether the inflammation is improved or whether it is deteriorating based on the finding out of these biomarkers like TNF alpha, CRP, interleukin 1, interleukin 6, and interleukin 8. So these are all uh, the biomarkers which are important so far as the periodontal infection is concerned. And in periodontal, there are non-surgical periodontal treatment and the surgical periodontal treatment. And the goals of therapy should be the restoration and maintenance of the oral health care. It should be, it should give a comfort to the patient, and comfort means there should not be any pain, there should not be any swelling. Also, there should not be any cosmetically any problem so far as the patient's oral health is concerned. Conservative treatment is very essential. Non-surgical periodontal therapy, performance of elective surgical periodontal procedures, implant placements should be a treatment can be considered at a later date. The various phases of periodontal therapy, we are discussing more on periodontal therapy because this is something very important so far as the diabetes is concerned, so far as infection is concerned, and so far as the oral care of the subject is concerned. The factors which are accentuating the periodontal disease in diabetic patients, there's essentially the duration of diabetes. The chronic diabetic patients, they develop much more periodontal disease than the recently diagnosed. The the uncontrolled diabetic patients, they develop much more periodontal abscess. Co-occurrence of complications like angiopathy, delayed wound healing, nephropathy, it's like kidney disease, neuropathy, as I mentioned earlier, the patient complaining of the tingling and numbness in the hands and in the feet, the retinopathy, which is leads to diminished vision in a patient, and the certain concurrent risk factors like hypertension, hypercholesterolemia plays a very major role. The effect of periodontal disease on diabetes. Periodontal disease can also have a significant impact on the metabolic state in diabetes, and particularly the presence of periodontitis increases the risk of worsening of glycemic control over a period of time. And there are various publications which are related to it, which have been published, which I have mentioned here. These are the other publications related to periodontal disease, which can how it affects the diabetes. This gives some idea about the therapy for periodontal disease, and this is one of the most important aspects is the antimicrobial therapy. Now, in antimicrobial therapy, the best thing is to give a correct antibiotic to the patients, and usually these are commonly the the anaerobic as well as aerobic organisms. And one needs to identify what kind of organisms are present, which causes the periodontal disease. And here, therefore, is very important to give a right kind of antimicrobial therapy. And this is still more difficult to treat, particularly if the patient has diabetes, because the patients have got a higher level of sugar in the body, and this because of the sugar, the microbial organisms that thrive, they multiply faster in the presence of sugar. So it again leads to the resistance of the antibiotic. So one has to very carefully select a proper antibiotic or antimicrobial therapy so that the suppression of the infection takes place at a very faster rate. The another thing that we must keep in mind is the oral cancer and dentistry. And the what is oral cancer? If we see, there is as you know, the cancer is the uh, multiplication of the cells in a very haphazard manner. This is a very colloquial kind of the definition, but it's a very correct definition, because in this the mitochondria and the nucleus divides and redivides in a very haphazard manner, which ultimately leads to the larger nucleus and less of cytoplasm. And this is a very peculiar condition, and this can be sometimes or most of the time it is symptomless. Therefore, it is difficult to diagnose the patients of cancer. However, fortunately for the oral cancer, the patients do come to the doctor uh, because they notice something different in the oral cavity. And this can be on the cheeks, it can be on the gums, it can be on the roof of the mouth, it can be on the tongue, it can be on the lips, it can be in the pharynx, it can be in the larynx, or even in the uvula in the oral cavity. And the major factor which is responsible for this is uh, tobacco, and which acts as the irritant factor. Another part which is again very visible in through the oral cavity sometimes, or very commonly seen, is the cancer of the salivary glands, and that includes parotid gland, includes submandibular gland, uh, and sublingual glands. These three are very common so far as the oral cancer is concerned. But here again, the tongue and the gingiva, the pharynx, the cheeks, and the gums, in that order, are the major sites for the uh, ulcers in the mouth and ultimately developing the cancer. You have to remember that any ulcer in the mouth, if it is not responding within a stipulated time period, immediately do the biopsy, look under the microscope, and try to see what exactly it is. Many times you will be right in diagnosing the cancer at a early stage. Look at the lymphadenopathy in the submandibular region, sublingual region, in the paratracheal region, and also in the sternomastoid region. So look at the lymph nodes also, which will give you an idea how far the cancer has progressed. The symptoms that you can suspect that the patient is suffering from oral cancer is any ulcer which is not responding within a stipulated time period, the age of the patient, the history of tobacco chewing, history of smoking, history of betel nut chewing, history of pan eating, history of gutka eating. All these one has to keep in mind before you rule out oral cancer. So very important in that. Another thing is there can be a referred pain in the ear, particularly if there is the ulcer in the eustachian tube region, which causes a referred pain. There can be certain time there can be a change in the way the denture is fitted or the teeth is fitted together. There can be pain which is of unexplained numbness. Then the change in the voice, hoarseness of voice, which is again one should keep in mind the CA of the larynx or CA of the vocal cord, or if there is any unexplained bleeding from the mouth, uh, which is not explained, and one has to rule out the uh, cancer. And last but not least important is difficulty in deglutition. As you know, the swallowing, the organs which play a major role is the tongue, is the soft palate, and the pharynx. So difficulty in deglutition, keep in mind, rule out oral cancer by doing various tests, including the biopsy, including the barium swallow, including the barium meal if required, and also try to rule out if there is anything else which is also preventing the deglutition. The treatment patients for the one of the line of treatment uh, for the cancer of the oral cavity is the radiation therapy. I would not advise you to go into too much detail of it because the radiation therapy will depend upon the type of the cancer, the location of the cancer, the phases of the cancer, like type phase 1, phase 2, phase 3, phase 4, how many lymph nodes are involved, whether there is any surgical treatment is given or not. So all that which plays a part. So the best thing is once you diagnose a patient of oral cancer, better to refer that patient to a cancer surgeon or the oncology physician who will take care of uh, the line of treatment for the cancer of the patient. The goals of the cancer therapy of course, is the cure, total cure if possible, preservation of the restoration of the form and the function, avoid or minimize the sequelae of the treatment, and the prevention of secondary cancer. Here, I think one has to keep in mind that oral cancer is not that easy to treat because of the limited space available, and invariably the diagnosis is on the later part, that is usually is in the advanced stage because the patient notices the lymph nodes and other things. And the second thing is this the chemotherapy and its side effects. The patients, many patients, they decide to give up, and the radiation therapy also leads to a lot of burns, nausea, vomiting, the depression of the bone marrow. So all these side effects one has to keep in mind, but at the same time, it's important to treat the primary cancer and also to see that how one can prevent the further occurrence of the primary cancer. That is, the how to prevent the metastasis or the recurrence of the disease. Here again, one has to keep in mind that invariably the treatment which is given is the block or the mass resection of the uh, tumor. And like if you want to see that if there is a tumor on the tongue or in the submandibular gland, what they do is to remove the tumor, and also they carry out the hemimandibulectomy. And if there is a hemimandibulectomy, there is a deformation of uh, the face, and also there can be an excessive salivation. And if there's an excessive salivation, there is a proper line of treatment that needs to be given so that the patient is comfortable while talking and while eating the food. So there are various angles for which the patient needs to be taken care of. The Now we will go to module 2, which is will be related to the disease and treatment part, and essentially related to the antibiotics. The antibiotics are of two types, bacteriostatic and bactericidal. When we say bacteriostatic is the one which will prevent the further growth of the organisms, while bactericidal are the antibiotics which will kill the organisms. But the best is to have the antibiotic depending upon the kind of the bacteria which is present, so that one can give the best efficacy with a minimal side effect of the drug. And this all, they can be classified as the antibacterial, which can be for aerobic and anaerobic organisms. Antifungals are like imidazole, voriconazole, fluconazole, which are mainly related to the fungal infections. Antiviral, and now antiviral can be for a simple organisms like which are causing the diarrhea, which can also something like influenza, Haemophilus influenza, right up to causing HIV and AIDS, and also something like papilloma virus, which is mainly in female to prevent the cancer of the cervix. There are certain vaccines now available which will prevent the cancer of the cervix if the vaccine is given in the early part of the life. Antiprotozoal, very important again here, this in particularly in our country, like amoebiasis, giardiasis, and trichomoniasis. These three plays a very major role. Amoebiasis, practically every third or fourth person in our country suffer from amoebiasis because of the water supply, which is uh, usually infected and not very clean. Anthelmintic again is again a food-borne disorder where there are worms like hookworm, roundworm, tapeworm, spinworms, which causes the various infections. Now, how do we bring about the control of these microbial organisms? Is barely to use the sterilizing agents, and which practically kills everything, and that is mainly is heat and radiation. These are the major ones which is used in every hospital, particularly the instruments and the hosiery which are used uh, during the surgery, which includes the gowns, the bed sheets, the towels, the all the instruments which are sterilized uh, mainly because of the heat and radiation. But here again, in heat, sometimes there are certain organisms which are heat labile organisms. They do not get killed. And so then we have to use certain disinfectants which are certain time very strong on the skin, particularly Lysol or for the ammonia. There can be various mild antiseptics which can be used topically but not ingested, like alcohol or iodine. And these antiseptics are mainly used on the skin and before the surgery which is carried out in the human beings. There are certain sorry, chemotherapeutic agents, and there are various chemotherapeutic agents which are used depending upon whether there is an expected gram positive organisms, gram negative organisms, also whether the infection is related to the fungus. So these three is very important, and in bacteria particularly anaerobic organisms are difficult to treat compared to aerobic organisms. The NSAIDs, which is also known as non-steroidal anti-inflammatory analgesics, uh, is again because any infection will have inflammation, and any inflammation will give rise to pain, swelling, redness uh, at the site of infection. And that is where the analgesics and anti-inflammatory drugs are of tremendous importance. And this, some to give an examples of analgesics and anti-inflammatory drugs like salicylates, which is aspirin, pyrazolone derivatives like phenylbutazone or oxyphenbutazone, which are one of the very old drugs available in the market. Indole derivatives like etolac or indomethacin. Indomethacin is again coming back particularly for patients of rheumatoid arthritis, where there is more of autoimmune disorders. Propionic acid derivatives like ibuprofen, naproxen, ketoprofen, phenoprofen, these all are the pioneers as the anti-inflammatory drug. Only side effects of this, particularly of ibuprofen, is uh, gastric bleeding in many patients, and they need to have antacid whenever ibuprofen is prescribed for them. Anti-retinic acid derivatives like mefenamic acid, anti-mefenamic acid, aryl acetic acid derivative like diclofenac. Diclofenac is very commonly used and is probably one of the safest NSAID. When I say safest, it does not mean it does not have the adverse events, but the incidence of adverse events is minimal with diclofenac sodium or diclofenac potassium. This anti-inflammatory drugs, they are also used for as an antipyretic drug, particularly when the patient's fever or the pain do not subside with simple drugs like paracetamol. Then the doctors prefer to prescribe NSAID to bring down the fever in the patients. The elimination or the excretion of the drug is mainly in the urine uh, of the patients, and this is uh, ultimately because of the metabolites which are easily filtered through the glomerulus of the kidney, and that at the same time when it goes through the glomerulus, it can also lead to certain time hematuria in the patients. There are certain mouth rinses available in the market which can affect on the plaque formation, which can have effect on the periodontitis, ulcers in the mouth, the infections in the mouth. So there are certain antibacterial mouthwash which are available, which has the impact on the bacterial infection. The advantage of this is it is being locally acting. The systemic side effects are reduced to a very great extent. This slide only demonstrates the how the plaque affects the mineralization of the cap of the, or rather it also has an effect on the covering of the tooth, and once it affects the covering of the tooth, it can lead to the decay of the crown of the tooth, which further leads to the infection in the pulp of the uh, tooth, and ultimately leads to the cavity. Here what happens is the enamel of the tooth is affected very badly, and as you know, the enamel is the strongest part of the body, but at the same time once it breaches, it can lead to severe infection in the body. Let us now go to the drugs which are useful in the various diseases, and we will cover the mechanism of the drug action, its pharmacokinetics, pharmacodynamics, and the safety of the commonly used drugs in the dental practice. The Here we will cover essentially the basic concepts related to pharmacology, drug nomenclature, and the drug dosage form. When I'm talking of drug dosage form, it's important to know that there are drugs which are available which can be absorbed from the oral cavity, and these are the mouth dissolving tablets. There are certain lozenges available, there are certain gels available, there are certain thin films available which one can put on the tongue or under the tongue, and it gets dissolved in a minute or two. So these are the various drugs formulation which can be very beneficial, very quick acting, because it's absorbed immediately and it doesn't go through the stomach and the intestine, and it can have the very fast impact, and these are the drugs which are helpful not only for infection but also for reducing the pain in the patient. So here what is more important therefore is the pharmacokinetics of the drug uh, and the pharmacodynamics of the drug. When we say pharmacokinetic uh, is defined as the what the body does to the drug. That is, once the drug is ingested, what happens in the body of the drug, and how the body affects the level of the drug in the blood. While pharmacodynamics is what the drug does to the body, that is how it affects the body as such and what kind of changes it can bring about in the body. So these are the two different things that one has to keep in mind, pharmacokinetics and pharmacodynamics. There is also a science called pharmacogenetics, and this is the study of genetically determined differences in the drug effect and the drug metabolism. Then there is something which is called as pharmacoepidemiology, where it is a study of the use and effect of drugs in large number of people. Pharmacoeconomics, analysis of the cost of the drug therapy. Here, the very important part is particularly at the time when the drug is to be launched, the new drug is to be launched, that they do carry out something like phase 4 trial, and also in that time they try to find out how the it will not only affect the quality of life but also how it will affect the costing of the drug compared to the products which are already available in the market. Pharmacovigilance, which is a very important branch now in the pharma industry and also with the regulatory body, and it deals with the detection of the serious adverse events, the assessment of it, understanding of it, how to prevent it, and also what exactly how it is to be treated, and at what level one can decide, and that helps in whether the drug should be allowed to continue in the market or discontinue from the market, or there can be certain warning put or a black box warning to be put in the package insert. There has to be some precaution. There can be some warning. There can also be a difference in the prescription of the product. Like if there are more serious adverse events, the subject needs to be closely watched. Then there can be a prescription only by the institutional doctors or by the hospital doctors. So far as the drug nomenclature is concerned, drugs are mainly into three categories: the chemical or molecular or scientific. There can be generic or a non-proprietary products, and there can be brand or trade related product or the proprietary product. So for your information, essentially the branded product, the generic products, these are the main two ones. Generic products are the duplicates of the branded products. While in the drug nomenclature, they essentially use the chemical name or a molecular name or a scientific name uh, for naming the product as such. The source of the drug are available essentially naturally or synthetic. The natural source is obtained from nature, from the plants or from the animals or from the weeds. The synthetic manufacturing is the one which is the chemical structure is found out, and they try to identify which is the most economical and the shortest method of manufacturing the products. There are agonist and agonist. Antagonist. Agonists are those which there are drugs which act simultaneously and they produce the uh, effect which will be response. It will produce the response which will be more positive for the drug. Let's say there are certain drugs which acts through the synapses, and these synapses they have certain enzymes. So the drugs will produce agonist effect, produce more enzymes, and bring about the results. There are certain antagonist drugs, they will try to suppress the enzyme mechanism at the synaptic level and then produce the better effect. So there are agonist drugs and the antagonist drugs. Preclinical evaluation and toxicology, this plays a very major role before the drug comes in the market and before the drug is registered for the marketing permission before it goes to the regulatory authorities. And this preclinical testing is essentially starting with in vitro, in vivo studies. Then there is animal study which are carried out, and in animal there is animal pharmacology, a safety pharmacology. There is animal toxicology, acute, subacute, chronic, then the sterility testing. So all these testing have is carried out before the drug is asked for the IND application. And once the regulatory body find that the drug is safe in animals, then only they allow the drug to be tried in human beings. So IND submission is the main partition between the preclinical, and then once the IND is approved, then the clinical trials are being carried out in the human beings. For the animal studies, the is essentially carried out to know the mechanism of the drug. Because unless and until one knows how the drug acts, what kind of action it will produce, whether it will have a synergistic effect or whether it will have an agonist effect or antagonist effect, that will bring about the exact mechanism of the action, whether it is an alpha blocker or a beta blocker, or whether it suppresses certain interleukins, or whether it has an effect on tumor necrosing factor, or whether it has an effect on mitochondria. So that will decide, the mechanism of action will decide what kind of response is expected, and in what a certain time there is some species difference also which can be seen, but one has to do all the animal testing so that one can decide what dose is expected in the human being, how safe will it be in the human being, what maximum dose can be tried in the human being without producing any serious adverse event. So animal testing plays a very important role in development of a new chemical entity. The pharmacodynamics is the main concept in this, is what does the drug do to the patient, to the subjects. Here the drug will produce certain effect. Let's say it produces the reduction in the temperature of the body. So that drug will be used for the fever and also for the pain and inflammation. Whether it produces the effect on the suppression of interleukins, again that will decide upon whether it will be used as an anti-inflammatory drug, or whether it can also be used for bronchitis, whether it can be used for asthma. So all these kind of stuff uh, can be seen through a pharmacodynamic effect of the drug. Absorption mechanism, the how the drug is absorbed. Now here there are various mechanism of action by which the drug gets absorbed, whether it is absorbed through the oral cavity, whether it is absorbed through the stomach mucosa, or it is absorbed through the intestinal mucosa, or even it mucous membranes in the various parts of the body. Let's say take the skin, whether it is absorbed from the dermis, epidermis, it will depend upon the uh, circulation of the products, circulation in the skin part, which will ultimately give an idea about the enhancement of the absorption uh, related to the absorption of the drug. The route of drug administration can be very many, and this can be the local application, like there can be external applications like oral, rectal, sublingual, parenteral. There can be inhalations, there can be injections. Injection can be intradermal, subcutaneous, intradermal, subcutaneous, intramuscular, intravenous, intraarterial, intrathecal. Intrathecal is in the spine, the vertebral column, intraperitoneal in the abdomen, intramedullary into the medullary glands or the intramedullary region. Intra-articular can be into the joints or intra-regional level. There can be also like an epidural, there can be also into the spine. So there are various routes of administration, and the other routes are like transcutaneous, which will be for the uh, induction, the jet injections, adhesive units, which are there are also certain patches available, the dermal patches, which uh, also has got something like osmosis. This there is a semi-permeable membrane which allows the passage of the drug into the skin surface. So there are various mechanisms and the various routes of administration of the drug. Once the drug is absorbed into the body, it moves around into the body till it reaches to where the mechanism of action needs to be produced. And that will be mainly through the plasma protein binding, tissue binding, and the reservoir of the drug. The drug, once it is absorbed, once it is circulating, once it is producing the effect at the site of action, it gets metabolized, and then after its metabolism, it gets excreted through the kidney. And then this drug metabolism is the major organ which plays a part is the liver of the body. And then the after certain metabolism, depending on the route of the metabolism, depending on the route of absorption and the chemical structure of the drug, it ultimately gets excreted through the kidney. So the urine and the stool is the major the tissues of the body from where the drug is eliminated out of the body. There are other places like sometimes it can be through the expired air. There can be certain times with the sweat. There can be certain time with the saliva. So these are the other routes by which the drug can be metabolized and excreted depending on the chemical structure of the molecule. This is essentially showing the most common route through the urinary tract infection, and what you see the U shape is the blood vessels and then the glomerulus, and the glomerulus filtrate has got the uh, metabolites which is then ultimately passing through the ascending loop of Henle, the loop of Henle, and the descending loop of Henle. Certain time they get absorbed at the ascending loop, and then they also get re-excreted through the descending loop of Henle. So there are various ways by which the elimination of the metabolite or certain time even the free form of the drug in the urinary tract. This graph shows you the pharmacokinetic effect of the drug, and the very important aspect here is one has to look at the C max and the T max. C max is the concentration, the maximum concentration in the blood of a particular drug, and the T max is the time taken to reach the maximum level in the blood. So very important is the C max and the T max, and the bell-shaped curve that one sees is called area under the curve. And this area under the curve gives an idea about the total quantity of the drug, how long it remains in the blood, and what is the elimination. It also gives an idea about the half-life of the drug, and depending upon the half-life of the drug, one can decide about whether the drug needs to be administered once in a day, twice in a day, or even 3 times in a day. So it depends on the half-life of the drug once it is administered. There is there are certain studies which are called as bioavailability and also called as bioequivalence studies. Just for your information, bioavailability studies is essentially done for the injectable products, while bioequivalence studies are done with the non-injectable products, which includes the oral administration, the suppositories, the pastries, etc. And in these bioequivalence studies, it is one has to prove that the drug available in the market and the drug which is produced by a particular organization, it matches so far as the Cmax, the Tmax, and the area under the curve is concerned, so that it will produce the same desired effect as that of the originator drug. And these bioequivalence studies are essentially carried out by all the generic companies to prove that their generic product is same as that the originator product, and it will produce or is expected to produce the same efficacy and same safety profile as that of the originator drug. So that is the bioequivalence studies that needs to be carried out essentially in the healthy subjects. Rarely it is done in the patients, and in the patients if it is done, it is mainly for the oncology products and for the HIV products, because those drugs are being more toxic, cannot be tried in the healthy subjects. The various parameters which are related to the pharmacodynamic parameters, that is the minimum if MEC, the maximum safe concentration MSC, the onset of action, the onset of time of action, the duration of action, and the intensity of the actions, and the therapeutic range of the action. So that is related to the pharmacodynamic effect of the drug on the body.
Now you can tell students to ask questions.
If you have any questions, I'll be happy to answer the questions.
In the 10 minutes, in the 15 minutes. You can put something over here if you want about studies like module. So we can complete after 15 minutes. It will get stopped. So till 15 minutes, anything to be done. You can speak anything more.
I'm very glad that you all are very much interested in the clinical research activities, and I'm sure that with this, recently you must have seen that there are more and more opportunities coming up in the clinical research area, and not only in conducting the clinical trials, but also for regulatory side, the pharmacovigilance, the patent aspect, the knowing about the clinical trial will also help in the positions of CRA, that is clinical research associates, the project managers, project coordinators. The You can also participate in certain time on the data management activities. Also, you can participate for the as a biostatistician so far as clinical trials are concerned. So there are lots and lots of opportunities so far as clinical research is concerned. The branch is prospering a lot. The regulatory guidelines are becoming more friendly for the industry, more in line with the international thinking. So there are less and less idiosyncratic kind of rules. They have changed many rules. One of the important thing is to granting the permission at early stage compared to what they were earlier, which used to take 4 to 6 months to get an approval. Now it takes hardly 4 weeks to get the permission to conduct the clinical trials. Another thing is the ethics committee. It is absolutely essential that every clinical trial which are carried out in the country should have the approval of the ethics committee. And ethics committee also now will require an accreditation. So there's a lot of responsibilities on the ethics committee, which is being formed. As you probably know, the ethics committee are of two types: the institutional ethics committee and independent ethics committee, and they have to follow certain guidelines. Besides this, there is also very important to learn on ICH GCP guidelines. And unless and until you know ICH GCP guidelines, uh, you cannot work in clinical research industry, whether it is in data management, whether it is in bioanalytical department, whether it is a clinical, as a CRA, or even as an investigator. There are certain guidelines which are put down by ICH authorities, and India is a signatory to it. So India has to follow ICH GCP guidelines. So very important to learn on ICH GCP guidelines. Very important to remember that the unless and until one takes an ethics committee approval, one cannot conduct any study, whether it is in the healthy subjects or in patients. So important thing is to have an ethics committee approval. Also, uh, the important role which is being played by the regulatory authorities in granting the permissions. They also have something like what is called as a subject expert committee. So every protocol is referred to the committee, and the committee decides whether the protocol is worth trying in the human beings. So every protocol has to have the subject expert committee approval also. So there are certain guidelines which are put down, which are good for the industry, good for the patient's participation, and good for ethical conduct of clinical trials, so that there are no questions left later on when the drug comes in the market. So the most important part is the safety of the product, safety of the individual who are participating in the clinical trial. So that we have to keep in mind. So uh, we
Any doubts?
uh, if you have any questions or any doubts, you can let me know.
There are 10 minutes left.
Hmm?
Still 10 minutes left. Let the students to ask the questions. If anybody asks question, you can answer it over here.
Yeah. Well, if you even later on, if you have any questions, do uh, let me know. I will give you my email ID. You can write to me directly also. So if you have any questions on this, what I have presented, and also on this module, my email ID is Kiran, Kiran, dot Marthak, which is Marthak @gmail.com. You can please feel free to send me any query that you have. I'll be more than happy to respond to you as early as possible. And I wish you a very good luck for your career in clinical research. As I mentioned earlier, that the clinical research is progressing very well. There's a lot of scope, and I'm sure each one of you uh, will be at a good position uh, in the clinical research over a period of time. So I thank you very much for your participation, and I wish you a very good luck. Bye bye. Have a lovely day.
Stop broadcast. Click on the stop broadcast.
email ID को मेरा दिया है so that in case if they are later on any question they can write.
You can stop broadcast.